I'm Dr. Chintan Doshi, a pediatric orthopedic surgeon from Mumbai. I've done my specialization in pediatric orthopedics from Mumbai. I've done my super specialization from Singapore and US. And we are here today to talk on different conditions of pediatric orthopedics which we face in daily life. Flat feet, basically, the term itself explains what it is. Flat feet means the medial arch, which is normally a curved shaped arch, that it becomes flat and the entire foot is touching the ground. So once the entire foot is touching the ground, the dynamics of the bones and the muscles of the foot changes, and that is what is flat feet. So when we see a child or an adult walking, and if the entire medial arch is touching the floor, we say it is a flat feet. So basically, it is uh, the position of the foot and the position of the arch of the foot, which is determining whether it is a flat feet or not. Many types of flat feet actually, because flat feet can occur in many conditions. One and the most common condition which I encounter in children is a flexible flat feet. So when the child is sitting or suspended, the foot is still showing a arch. But when the child is walking and weight bearing, the arch drops and then it looks like a flat feet. So that is a painless flexible pace planus, which is painless flexible flat feet. And it usually requires no treatment, just some exercises, look into how the child is growing, and probably the child will be painless or symptomless for the rest of the life. Then there are pathological flat feet which will cause problem to the patient. So it can be because of tarsal coalition. So tarsal coalition basically the small bones of the foot are joined to each other, and there is no gap between the bones, and they are fused to each other, which will cause a presentation of a flat feet. Flat feet can also occur if the muscle imbalance of the foot causes the arch to drop. So if there is tibialis posterior insufficiency, which is a muscle which is helpful in formation of the arch and strengthening the arch level to a particular point, if that is not acting at sufficient levels, it would lead to a flat feet. So there are multiple more other causes, neurological flat feet and other causes, which are basically problematic, and those are the ones which will require some form of advanced treatment and other procedures. If it is a painless, flexible flat feet, it is something which is symptomless. Parents will bring the child, it is looking flat. Child is absolutely fine. He's playing cricket, he's playing football, he's doing all sorts of activities without any trouble. So actually, a painless, flexible flat feet is not symptomatic. It is asymptomatic, and they are happily going around in their life without any problems. The actual problematic ones are those pathological flat feet. So what happens in the symptoms that develop because of the abnormal pressure on the foot and the arch which is not there, the bones are completely touching on the ground, and the complete weight bearing are going through those small bones. The area where the arch is supposed to be present is the one which is bearing the weight. So it is abnormal bearing of weight on those bones which will cause them pain. So first of all, the most common symptom of flat feet is pain. Then as the progress happens, the movements of the foot become rigid, and then there is problem in doing some activities of daily living like playing sports, running around, doing long walking and everything. So these are the symptoms which they will present with. As you asked about the complications, per se there are no major complications of flat feet, but yes, if a painless pathological flat feet is not treated, they eventually in a later age, when they are around 40, 50 years of age, because of abnormal pressure, would develop some kind of arthritis of the small joints of the foot. It may be subtalar arthritis, it may be ankle arthritis, it may be arthritis of the mid-tarsal bones, but it all depends on what is the pathology. If it is tarsal coalitions, it will be in the mid-tarsal bones. If there is abnormal shape of the other bones, then it will be in some other joints. So these will be the later on complications. When the person is around 50, 60 years of age, and there is constant pressure on those abnormal bony mechanics. So this will what will cause the complication of flat feet. Flat feet is diagnosed, first of all, simply by looking at what is the deformity, where, where is the arch, how flat is the arch, how much supple it is. So it is basically a clinical diagnosis. Clinical diagnosis, by which we mean we don't need any special X-ray, MRI initially to diagnose a flat feet. So a flat feet presents itself. We can see that it is a flat, the foot is flat, the arch is not there. We can see that the foot position from the bottom, from the plantar aspect, is deformed, and the joints have less mobility. There may be stiffness of some of the intertarsal joints. So all this is clinical diagnosis, and this is the most important. The clinical diagnosis is the most important, as it will give you a perfect diagnosis of a pathological flat feet. Now, to confirm this clinical diagnosis, we have X-rays, we have MRI, and we have something called as foot barometer machine. So X-ray is simple. We'll take a X-ray of the foot in standing position, and we see how the bones are oriented, and that will give us a diagnosis of a flat feet with calculation of angles between the bones, which will tell us the severity of flat feet. A MRI or a CT scan will diagnose the bony abnormality or the cartilage and ligamentous abnormality because of which the flat foot would have occurred. So the etiology of the flat feet. So if it is the two bones are fused to each other, which is coalition, will be seen on a CT scan or a MRI. If it is posterior tibial insufficiency and tenosynovitis, then on the MRI we will see that around that tendon we see that there is edema, there is red, there is collection of fluid and everything. So these are for diagnosis of flat feet. One thing which I mentioned about foot barometer machine is a pressure machine which we make the patient stand on, and we see what is the pressure exerted by the patient's body weight onto the ground and where is the maximum pressure occurring. And that will lead us to what can be the treatment solutions for these flat feet patients. One, which is the first one, flexible flat feet, which is not symptomatic. Okay. For those kids, for those adults as well who have flexible flat feet, the treatment is very simple. Doing some plantar arch exercises to strengthen the plantar arch. We can, for their symptomatic relief of, unable to walk long distance or doing some sports activities, during those activities we can give them insoles with a medial arch, which will be supportive to the arch which is dropping down on weight bearing, and this arch can go into their shoes of daily living. So those who are using sports shoes can put the arch into the sports shoes. Those who are using normal shoes can put the arch into the normal shoes. So it is customizable according to the patient. Coming to the treatment of a flat foot which is occurred due to some reason or abnormality in the bone in the of the bones of the foot, we treat them according to their problems. So if there is fusion of the bones like a tarsal coalition, if the two bones are fused, what we try to do is we do a procedure when we separate the two bones and create a space between them, create a joint between them, so that it is not painful to the patient. For posterior tibial insufficiencies, we can give symptomatic treatment for edema and the pain of the tendon, and we can give some supportive splints which will help the patient in the long run. There are flat foot reconstruction surgeries, but if we see around 100 patients of flat feet, maybe less than 10%, even that is a higher number, maybe less than 5% would require some kind of a bigger surgery, or going through a lot of complicated surgical procedure. 95% of them would be treated by smaller maneuvers, exercises, insoles arch, doing smaller procedures which are the pathology in the foot which is causing a flat foot. Basically, flat foot is something which is developing over a period of time. So every child which is born will have a foot which is looking like a flat foot because of the baby fat which is there in the sole of the foot, and that is a natural growth of the foot which initially looks like a flat foot, and then the arch develops and is actually seen after 3 to 5 years of age. So as the child is developing, we will have to notice how the foot position looks like and how the arch is developing. So if in the early stage, if we see that the flat foot is developing and it is causing pain to the child, yes, it can be prevented into going into further progression. Flat foot is already developed. It is not we cannot we avoid it by giving some medicine or something. It is not possible. But once we diagnose it early, we can prevent the further complications and long life pain for the child or for the adult, and we can get through for them to do their daily activities, sports, and other things. They progress into the into life, so they don't get that pain and they don't have to suffer from flat feet.